Hey there, welcome to my channel, Nurse Pokes, your go-to space for trusted health tips, wellness, inspiration, and everyday care made simple. I'm Nurse Pokes, and I'm here to help you take charge of your health, one step at a time. If you're ready to feel better, live stronger, stay with me. On today's episode, we are talking about BV. One may ask, what is BV? BV simply stands for bacterial vaginosis. Bacterial vaginosis is a common vaginal infection caused by an imbalance in the natural bacteria found in the vagina. Normally, the vagina contains a mix of good bacteria like lactobacilli and bad bacteria like anaerobes. BV occurs when the bad bacteria overgrows and disrupts the balance. Now we'll look at some of the signs and symptoms to look out for when you have BV. Here, there's a thin gray or white vaginal discharge. So instead of you having your normal discharge as a woman, this tends to be thin gray and white. Here you may have BV. And then there's a strong fishy odor, especially after sex. So after sex, if you smell anything fishy, strong or bad odor, it means you might probably have BV. Then there's itchy and irritation. If you're constantly having itchy and irritation, you may probably have BV. Then there's burning during urination. So if you feel any burning sensation while you urinate, or you feel like constantly peeing, you may probably have BV. So if you notice any of these, do not panic. Contact or speak to a healthcare provider. So we move to medical diagnosis. There's medical review history. If you visit the hospital, the healthcare provider would definitely ask you for your past records. Then there's pelvic examination, there's vaginal discharge sample, which is taken to test for pH. Then there's whiff test, a chemical, usually potassium hydroxide, is added to your discharge. A fishy odor is released that confirms the presence of BV. Then there's microscopic examination. Moving to the next is medical treatment, or how to treat for BV. So there's antibiotics like metronidazole. It can be oral or gel. Then there's clindamycin, cream or oral. Always make sure you complete your full course, even if symptoms go away. One may ask, what can I do to prevent BV? Here are some of the things to do to prevent BV. There are probiotic foods like yogurt. There are also prebiotic foods like garlic, onions, and bananas. Also, make sure you take plenty of water. Stay hydrated. Limit the amount of sugar you take in and processed foods. Also, prevent douching. The vagina is a self-cleansing organ, so do not try to push in water just to cleanse it. Then you use mild and unscented soaps. Practice safe sex and limit new sexual partners. Wear breathable cotton underwears. As we come to the end of today's episode, I want you to know that BV is common. It is treatable and nothing to be ashamed of. The more we talk about it, the more we empower ourselves and others. If you found this helpful, share to a sister. Subscribe for more health tips. See you in the next episode. Bye.